President Wadud Bhai is here. It's really great to see so many learned people here. It's a great honor. So after the exciting talk by Prashantoda and Selim Bhai, I'm going to talk about a very dry topic, which is career guidance for cardiac surgeons, which I think is really important because every conference you go to, you see this doom and gloom talk by everyone saying how bad future of cardiac surgery is. These are my disclosures. So I have been in various training committees in UK, and I know a little bit about training in cardiac surgery. So I'm going to just say a couple of things from my experience. So in my talk, I'm going to cover what are the qualities of a cardiac surgeon, the UK training pathway, what are the fellowship opportunities for BD doctors, because I think it's really, really important. And finally, I'm going to talk a little bit about future of cardiac surgery. Now, as a cardiac surgeon, what are the qualities you need? You need to have good technical skills. You need to have good anatomical knowledge and physiological knowledge so that you can do problem solving, you can do a diagnosis. You need to be a team worker so that you can work with other members of the team. You need to have excellent communication skills. And finally, you need to be strong. You need to be able to have emotional resilience and stress management. This is absolutely important. Now, the knowledge base is very important. What are the books you should go through if you are setting off a career in cardiac surgery? This is a book which I found to be very useful. Then another book, which is the Oxford Handbook of Cardiothoracic Surgery. It's a concise book. It's a fantastic book. You need to read textbook, but in the Western world, I don't think people spend too much time on textbooks. I have read this textbook only once before my fellowship exam. Then you need to read a lot of small books which are very important, like the TSRA, Review of Cardiothoracic Surgery. It's a small, concise book which has cardiac surgery, thoracic surgery, pediatric surgery, everything within it. Then there are two fantastic books which are used by UK trainees, Key Questions in Cardiac Surgery by Noreen Murjani, who is the current president for cardiothoracic surgery in Great Britain and Ireland. Then once you pass the exams, you need to concentrate on your advanced surgical skills. And that's where this Atlas of Cardiac Surgery, YouTube, all this comes up. Atlas of Cardiac Surgery is a book which came out of Cambridge. I have written 3 chapters there, and a lot of people have written 3 chapters. So overall, these are the 3 main books you need to concentrate on if you're going for any fellowship exam. And this is the book you need when you become a pro. What is the UK training system? So you pass your MBBS exam, then you do your foundation training, which is the internship, equivalent to the internship that takes place in Bangladesh. Then cardiac surgical training, in our time, it used to be 8 years, it's 7 years now. So you start from ST1, you go up to ST6, then you do the FRCS exam, then you go into final year ST7 training. After that, you become a day 1 consultant equivalent. After that, what you have to do some fellowships so that you can do super specialization. Like after I finished my training, I went to Professor Jebreen Al-Khoury to learn complex aortic repairs. Now, the whole training program is divided into 3 phases. First is the initial phase where you learn a bit of everything, whether you're a cardiac trainee or whether you're a thoracic trainee. Then you enter into phase 2, where you know that you are either going to be a cardiac surgeon or you're going to be a thoracic surgeon, and you concentrate more on the specialty where you want to specialize. During this time, if you have interest in transplant or congenital, you can spend some dedicated time in those specialties. Then you enter the phase 3 once you have done the FRCS exam. This is the most important 2 years of your life when you specialize in more advanced techniques. And then once you get your CCT, if you want to do congenital surgery, you have to do extra fellowship. Or if you want to do transplant surgery, you have to do extra fellowship. This is what's expected of a day 1 consultant. You need to be able to run a theater list. You need to be able to deal with emergencies. You need to look after inpatients and outpatients. And you need to do MD team working, multidisciplinary team working. What are the index cases? In cardiac surgery in UK, it's isolated first-time CABG, isolated first-time AVR, combined AVR and CABG. Perhaps in the context of Bangladesh, you can include mitral valve replacement within this. Now, there are different abilities. So Level 1 competency means that you are able to assist. Level 2 means that you are able to perform part of the procedure. Level 3 means that you are able to do it very well, with minimal guidance. Level 4 is you're at consultant level. You can do everything fluently. So in your phase 1 of training, so the first 3 years of training, you are expected to perform part of the index procedures under guidance. In the second phase of training, which is the ST 4 and 5 years, you need to be able the procedures with minimal guidance. In the final year, you should be up and running. You should be able to do these procedures on your own without any kind of problem. And this just shows what it takes. And usually at every placement, we have initial meeting, we have an interim meeting, we have an end of placement meeting. Now, let's talk about Bangladesh. So theoretically, you pass MBBS, then you either do FCPS or MS or MRCS. What are the fellowship opportunities? Fellowship opportunities are in Asia, like my friend Arman went to Malaysia. I know a lot of people went to India. Salim Bhai went to India. Then there are fellowship options in USA, like Professor Kamrul went to USA. Then there are opportunities in Australia, like Zia went to Australia. Then there are UK opportunities. Lots of people went to UK. Now, if you are 45 plus, you are up and running, what you should do is you should not go for a formal fellowship. You should go for a travel fellowship for only 2 to 3 months. If you are between 40 to 45, you can go for a 2 to 3 year fellowship. Remember, this is cardiac surgery. You can't train someone to do cardiac surgery at the age of 50. If you are under 35, you should go for a formal training where you spend 5 to 6 years in a proper training program. Now, talking about traveling fellowship, I'm a trustee of Planetary Health Academia. We give out travel fellowships every year. This year, we have given it to 2. This is our first travel fellow, Rafi, who went to Royal Papworth Hospital in Cambridge, spent 8 weeks there. He took part in operating cases. He took part in multidisciplinary meetings. He got to know lots of world authorities. He attended courses free of cost. He went to the London Core Review course. Finally, he went to Professor Al-Khoury to see some specialist cases. So, these are the opportunities we have. Now, the most important opportunity I want to talk about is the MTI, Medical Training Initiative. If you have a Bangladeshi qualification with English knowledge proficiency, you can get MTI, where you get 2 years of training in UK. This started only recently. Last February, when I was here for the PHA conference, we took interview of lots of people, and we selected 16 to 17 people for MTI across different specialties. Tarek, who is here, Tarek Morshed, he's the first MTI fellow in cardiothoracic surgery. So he's going to Cambridge for 2 years to work as an SHO, followed by a registrar. So that's a good fellowship. This is me. I was the SHO to John Pepper, whom I met recently in the AATS. Pedro Catharino was my registrar. When I went to UK in 2005, people told me that you are mad. Don't do cardiac surgery. It's going to stop in 5 years. Pedro was asked to leave cardiac surgery. Aziz Momin, who was 2 years ahead of me, he was asked to do something else. Joanna Chikwi was asked to do general surgery or something like that. Aziz Momin runs the London Core Review now. Joanna Chikwi is the chief of Cedars-Sinai with a waiting list sky high. Pedro Catharino is the director of transplant of Cedars-Sinai. So do not listen to people who say negative things about the specialty. This is a projection by the AATS. In the 96 conference, it got presented that there will be 50% increase in workload and there will be severe shortage of cardiac surgeons by the year 2035. Because you need to understand, TAVI is here, but because of TAVI, we are considering 82-year-olds, 85-year-olds for surgery, whom we would have never, ever considered in the past. This is an interesting survey which was conducted in USA on 111 people. And it has shown that transplant and aortic specialties were the most popular specialties among the cardiac surgical residents. And the most problem was their greatest hesitation about cardiac surgery were 2 things. One is a toxic work condition. Another one was work-life balance. Well, this is a paper all of you need to be aware of, sexual harassment in surgery and cardiac surgery as well. More than 50% female surgeons at some point in their life in the Western world has faced sexual harassment. So there are a lot of female trainees here. If you experience something like this, you should not keep your mouth shut. You should report it to the appropriate authorities. Work-life balance depends on how you make your life. It doesn't depend on your specialty. I have seen general practitioners who do not have work-life balance. I've seen cardiac surgeons who have a very good work-life balance. Finally, always be positive. Think about the bright future. My advice to the future trainees will be familiarize yourself with robots, learn transcatheter skills, because transcatheter wire skills is extremely important. Learn minimal invasive cardiac surgery and get ready to do lots and lots of redo cardiac surgery. Lots of TAVI patients will come back for redo surgical AVR, and travel the world, do some fellowships. Thank you very much. These are my contact details.
Thank you, Dr. Shakil Farid sir, for your excellent presentation. I think juniors will be very much helpful.